Hi, Dr. Sutton. It's Jaquita Criswell, and I am sending you my MFT 6102 Week 3 assignment for the class Psychopathology, Diagnosis, and Systemic Treatment. I will be providing with you a description of the disorder, a diagnosis with supporting evidence, and a treatment plan for a client, Efren, who is in the video Psychosis, a clinical psychology session. So based on the experiences that I've heard and seen from the video and the initial session with Efren, I diagnosed him with schizophrenia with hallucinations. That was the most closest schizo disorder that I felt fit him, since I automatically ruled out the delusional disorder, since he did have some symptoms of schizophrenia, in which delusional disorder you cannot have any symptoms but just delusions for longer than 1 month period. I also ruled out schizoaffective disorder, seeing as I did not see any signs of mood disorders, or nor did I hear in the initial session any mood disorders from Efren. It seems like some of his personality has been consistent in his moods, aside from the recent delusions experience, hallucination experiences, and locking himself in the room. So, as we know, initially Efron was locked up in hospital involuntarily for a week because he did lock himself in his room. He was very distant from his family, isolated. He feared them. He thought that they were spying on him. He felt that they were monitoring him, watching him very closely. Efren has been experiencing voices in which he hears critical voices 4 to 5 times a week. He did mention in the video that he hears his grandmother's voice, which is not a critical voice for him, but a very positive, encouraging one that happens to get him through times when he's struggling, encourage him to do things that he's not feeling so up to. Efren also mentioned that the voices, he usually hears them when he's doing work or schoolwork. Over the time period of Efren's symptoms, he has been reported to not go to work, so he has isolated himself from his family, his friends, the few friends that he does have. It was reported in the video that he has not had that many friends, and he has not had any romantic type relationships or partnerships, and he pretty much keeps to himself. I will talk a little bit about schizophrenia. I would say schizophrenia is a psychotic disorder that is characterized by hallucinations, delusions, disorganized speech, mood disorders, and these characteristics are not in combination all the time with each other. Sometimes there's one or the other. Sometimes there's 2 or 3 conditions existing together. Also, schizophrenia, people with schizophrenia experience sometimes multiple episodes. Some can have 1 episode, some can have intermittent episodes where they come and go. Again, like I said, I ruled out schizoaffective disorder and delusions. In Efron, I did notice some, I don't know if his isolation is considered to be a negative symptom, since he did withdraw from his friends and family. And one of the positive symptoms that I noticed was his hallucinations. They are auditory. And I know that that's a very common form of hallucinations in schizophrenic patients. I did notice too that he experienced a social occupational dysfunction. Since he missed school and work, I kind of wanted to specify that a little bit. What else did I notice? Let's see. Okay. And so from there, I want to talk about a description of the disorder. Again, I said I think Efron has schizophrenia with hallucinations. I know that schizophrenia with hallucinations, so with auditory hallucinations particularly, involve voices. So the person is hearing someone talk to them most of the time. The voices can give commands. It can be a running commentary. It also could be telling the person what they should or should not be doing. It can. Most people with auditory hallucinations, they can carry on conversations with their voices. The voices can give warnings, and it can potentially put them in danger depending on the command that it gives them. There also can be music and auditory hallucinations. Um, I know based on schizophrenic.com that um, the patients with schizophrenic are vulnerable to suicide and violence if they do are compelled to obey the voices if it's a violent act or it's a violent command. So that can be very problematic. Um, the voices can be problematic if it's telling the client not to take medication, in which the medication helps combat the hallucinations, and if the patient is not taking it, that can be a negative effect. And lastly, about schizophrenia disorder, just in general, it usually occurs in adolescent age range. So the symptoms begin during the adolescent times. In males, it's mostly between the ages of 16 and 30 or 18 and 21. And so symptoms can occur very early or sometimes peak at adulthood. For Efron, based on the video and initial session, it seems that he recently experienced these schizophrenic symptoms, which I know in the video he tried not to say that the word schizophrenic to not stigmatize, but I know that I'm giving a diagnosis, so I wanted to just specify that I do think it's schizophrenia with hallucinations. And so I do want to say that I think along with hallucinations, that maybe Efron could have, or a specifier could be avolition, which is, again, isolating himself from family and friends, stopping normal day activities like going to work and going to school and things like that. What else did I want to add to that? And besides that, I wanted to talk a little bit about schizophrenic possibly being genetic. It can also be from an excess of dopamine in the brain, and it can also be from a brain abnormality in which the activity in the frontal lobe is low. And so we know the frontal lobe affects the motor functions, problem solving, impulse control, and judgment, language, social and sexual behavior. And so schizophrenia is not specific to one culture or race. It's definitely across the world. And so any race, culture, or group of people can have schizophrenia in some form. And so for a treatment plan, I wanted to talk about and recommend narrative therapy. I chose narrative therapy because for one, that's my therapy of choice in the last few classes, but also because narrative therapy focuses on the positives. It's a solution-based therapy model, and it was founded by Michael White and David Epstein, and it really helps, and the clinician's job is to help the client access resources and strengths within themselves in order to create a more meaningful and purposeful life and understanding of things and events in their life. And so I think in Efron's case, that since he has been basically his life has been, since his episodes and symptoms has been focused on the problem, him coming to therapy immediately, as he said in the video, his family sort of just made him go to therapy after this first episode, so much that I know from the video. And so that the issue is a problem, so that's what everyone's focusing on. So I think for therapy, and narrative therapy will help to get away from the problem, as it can be overwhelming for him, and to focus on the positives. And so with that, I made some notes about narrative therapy and pertaining to schizophrenia. And so, again, narrative therapy is a postmodern therapy as well. And so it's based on the premise that we create our story and the meaning of life through the events that are available from our dominant and local discourses. So in this video, I noticed that the discourses in Efren's life is his culture, so his Filipino culture. It's his gaming culture. That's who he's at. These are also the same this context that he's identifying with. So gaming culture, as the clinician in the video put out there, the culture of the local San Diego culture, and again his Filipino culture. And so within those can hold discourses that impact the way Efren feels about his life, the way about his disorder, what he characterizes himself as, his abilities, the way others see him, and as well as based on the discourses in his family, they can stigmatize the illness, see it negatively, respond to have high expressed emotions, in which that would affect Efren's progress and success. And so I wanted to highlight that. But most importantly, in narrative therapy, the process begins with the therapist separating the problem from the client. So it would be to help them see and act and interact in new ways, aside from the problem, in ways that they haven't. And this may be helpful in schizophrenic clients who hear voices or have hallucinations. So since the hallucinations are disruptive to the client's own thoughts and behaviors and feelings towards themselves and others, if as a clinician I can separate the voices for Efren, the client possibly could feel more in control and encouraged to challenge the voices. And so I think this would be a great start for Efren in learning to manage his voices and things that he hears, so that he can feel normal, in which normal he defines as being able to go to work and go to school, and sort of communicate and manage his needs with his families. Also, from a case conceptualization perspective, I think in the initial session, I would begin from a narrative therapy perspective. I would want to understand what Efren is experiencing, his reason for therapy, in which he said is his parents are making him come to therapy. He doesn't really see a problem yet with who he has become. Well, not who he has become, but with the voices. He's comfortable with the voices, and he says that, mostly he's comfortable with them because he hears his grandma, and which his grandma recently just passed, and so he felt it was very close to her, and her voices are very encouraging for him. So he doesn't mind the voices, but he says that it's his family who has a problem with them. And so that would be something to talk about in therapy. Again, I would discuss the dominant discourses that are a part of his culture, which is his family, his Filipino culture, his gaming culture, because that is a resource that he belongs to, that he feels comfortable with, where he says he meets friends to know what they think about it, how they feel. Maybe that can help him, and how he feels about himself and his symptoms and his diagnosis of schizophrenia. I would want to understand, to help Efren understand also the oppression that he may feel from these discourses, and help him understand, as well as myself, understand how they are impacting his life, in the way that he deals, interacts with himself, others, and thinks of his illness. In the treatment phase, of course, I would want to get to know the client, because that's very important in narrative therapy as well. Each session is less about the clinician being able to dictate or sort of control or be of this hierarchy in the client's life, but more so about being able to allow the client being in control. And I think this is important for Efren, since he is from a family where the hierarchy stance is very important, as I mentioned in the video. His dad has all the say-so, and so he conflicts with his dad because, just for example, about church. Efren goes to church. His family goes to church every weekend. He does not want to go because he says this is a time where the voices really come out, the critical voices, and he doesn't like going to church. And so, but if he combats that with his father, and when he did speak up, his father threatened to put him out. So there's little communication or little um, room for voices and for change in this family because it's a hierarchy status and it's dad what dad say goes. And so I would be willing to talk about that in treatment as well from a narrative therapy perspective, and sort of also including the family into a session. That would be one of the interventions I look at as well from a narrative therapy perspective. And a systemic perspective is to include the family inside the therapy session at some point. And I know that this may be more of a challenge with Efren since he is very paranoid and fearful of his family finding out about his sessions and the things he says and what his thoughts are. And so I would be very critical and tiptoeing into that, but I would definitely try to work a way for the family to get in so that they can be on board with Efren's illness and in communicating and helping him manage his his illness better, as well as being ensuring that he is in a successful recovery phase, or if there is something that sets him back, that the family is there to be of support, because support is a very important aspect and context of narrative therapy as well. Also, I made notes about goal setting. So I wanted to talk about the fact that Efron was normal before his symptoms hit. Well, his normal is, like I said, working, going to school every day, making money. That was his regular life and doing things with that. And so one of the goals that I would put in place from a narrative therapy perspective, because goal setting is very important, is getting Efren back to feeling normal, but in a way that is not trying to recreate. I want to recreate the story that he has with his illness. So getting him back to normal, but with this diagnosis, with possibly taking the medication, managing his voices, challenging his voices, but getting him back to being able to go to school and go to work would be a goal to help Efren feel normal, as well as to help him, since he feels that his family is so important and their thoughts and what they think and want for him is important. I'm sure that would make them happy, and as he mentioned, his dad wants him to just be normal again, and so that will help the family and Efren in his goal setting. Efren is very fearful of others, of his family, and so I would want to separate the problem of fear as it acting upon him. And so fear came into his life, and it started taking over his life, and started taking over his thoughts, and make him think that his family is out to get him, and people are spying on him and monitoring him, and he's very fearful of the cabinets and the art in the room and those things, because of fear has came and took over him. And so maybe in some way, if this symptom occur regularly, Efren can think about the symptom as an outside source and not as of himself, and therefore maybe he can control it or separate it quickly enough to not let that aspect take over him in that time. Again, celebrating small victories, as mentioned in the article with Harding, as well as in narrative therapy, congratulating the client on coming to therapy. Questioning is a very important intervention that I would take upon with Efren. I would want to, is it okay that I ask you this? I'm wondering if you would like to bring in your family, or how does it feel when this, or how, like, I think that those questioning is very important for Efren, since he does not have too much of a voice at home. He does not have a voice too much in his life, and then now to have voices that he's hearing in his head, that it's probably a power struggle, and making him question his self-esteem, who he is, his confidence, everything about himself. I think it would be really important for me to ask permission, to question, to see how he feels, to get his input, because narrative therapy is all about allowing the client to lead the story, to tell their story, and not about me, and less about me as a clinician or any other clinician taking over, taking control, and creating their own story for Efren. And I do not want to do that, since I feel that he's already experiencing that in his culture with his family, in that context, and other discourses. Um, it's very important to acknowledge the resources that Efron has. Again, his love for video games. He values family. He has a community in San Diego, a culture that he belongs to. He says he belongs there. He feels like that is a part of him. He's been there since he was born. So I would like, as a narrative therapist, to access that, to acknowledge that, to reassess the strengths in those things, in these particular things, even the closeness with his cousins, in some way get Efren to see that he's not alone, because he did express that he feels alone. In the video, the clinician talked about mental illness, because in narrative therapy, as well as in the video, it is very important. Diversity in culture is very important in narrative therapy. And so it's very important to include the Filipino culture and how it impacts, how it looks at mental illness, how it responds to voices, how Efron believes, how based on why he believes what he believes about his voices. And so in the video, Efron believes that he says that his family is going to think that he's crazy because he has to take medicine, because he has to go to therapy. And he says that it's not something that he sees in his family. He don't see people going to therapy. He don't see anyone taking medicine. And so that can cause more conflict in his life. And so I would like to acknowledge that, so that we can talk about it in therapy, and it could become a goal to sort of get his thinking, reauthor his thinking in a different way, to not see his family as fearful, or to not think of himself in such a negative way from the perspective of his family, because he is worried as well that his family, that he may not look good, and he may be shamed by his other family members, by the community, and by his own family, his mom and dad and sister, and which he says this is why he stays in his room, because he fears that they will think he's crazy, and that and it makes him not feel good about himself. Efron did talk about pressure in his family to do everything right, and but I think it's important as a narrative therapist to highlight the fact that he comes to therapy, and he came to therapy in himself, again, celebrating small victories, accessing the strengths in the client, and reassessing the resources that he already has. And so even though Efren decided that, it wasn't his idea to come to therapy, even though he does not understand why he's here, he doesn't understand and see his voices as a huge problem, his willingness and drive and his loyalty to his family, honestly, and his to even give it a try, is something that I would definitely pay attention to and highlight in himself in therapy sessions. Again, I would talk about, from a cultural perspective, how hallucinations are looked at in his family, or voices. And so Efron talks about in the video how his grandfather, how his loved ones dreams of sometimes their voices or loved ones, and so they connect that to hallucinations. Talks about how his dad sometimes hears noises around the house around the timing of his grandfather's death, and that can be connected to hallucinations. But his family has not experienced hallucinations to the extent that he has, and so adding more to the story would be reauthoring the story, adding more to it, reframing Efren's sensitivity to his voices, and his sensitivity to hearing it more than his other family members, as the clinician said in the video, and sort of seeing that as more of a strength, because Efren